Good afternoon, guys, and welcome to our June 25th TATT Chat. For those that don't know me, I am Terrence Roberts. I'm mayor of the city of Anderson, and I'm the current chair, TATT. I think doing this, we were just talking before everybody came in that we are still Zooming and still trying to stay connected over the 10-county region. I think it's important that we do that. I think it's important that we keep an open dialogue about the things that are going on in our community. We've been very successful over the last several weeks of having speakers that talk about things that impact our communities. I'm pleased with Dean and his team in being able to put all that together. And today we have, our guest today will be Congressman William Timmons. Congressman represents the 4th Congressional District, and he just talked about being in Washington, and we all said we appreciate him going back and traveling back to Washington, and I know he'd rather be in the Upstate, but we appreciate him being here. I think he brings a combination of a lot of different things, perspectives for our communities. He's obviously he's a politician, he's a small business owner, and he grew up in the area, so he's well versed in a lot of the things that affect our 10-county region. So with that, I want to bring Congressman William Timmons on and to share a federal update. Congressman?
Well, good afternoon. I want to thank you all for being with me. Sorry we're not in person. As he just said, I did just get back to DC yesterday. It's been a strange year for everyone, but I literally have been in DC for 7 nights since February. So I've been at home for the last really 4 months, and it's been very unusual. We've been working extremely hard from home. We're very fortunate we had all the technology necessary to telework. A lot of the offices up here did not. They had more, desktops. We had all laptops, and everybody had their cell phones, so we were able to telework seamlessly. We've been working really hard to help get things back on track. Obviously, we had to shut down. It was the right thing to do, and the federal government has taken extraordinary steps to make sure that this economic, our challenges economically have been mitigated to the best degree possible. Flattening the curve and maintaining a hospital, a healthcare capacity was very important. Obviously, we're dealing with that again right now. We're in a very good position in the Upstate. I'm happy to answer questions about all the different economic relief endeavors we've done, whether it's the CARES Act, the follow-up to the CARES Act, future opportunities. The federal government did a good job, in my opinion, given the parameters. It was very challenging, but we have sent over $4 trillion of economic relief in the last 3 months, and I was very proud of the federal government as they were responsive to the different needs of the people in the business community, or the people that were on unemployment, or the businesses that needed to find a way to survive this. I'm calling it the Great Pause, but with that, South Carolina's in a great spot. I think at the end of this, we'll get a vaccine here between December and March, April. Things will start returning to normal then. But Greenville and Spartanburg are going to, we're going to see a lot of benefits. I think there's going to be a lot of manufacturing coming back from overseas. I think a lot of people will leave larger cities because teleworking does work. I mean, our team has been incredibly effective using our cell phones and laptops. And I've got this fancy Zoom light. We're getting used to this, and we're proving that we can be extremely effective using technology. So I do think that that's going to be to some degree here to stay. And I think the upstate of South Carolina is going to benefit substantially from it. So, with that, I just want to thank you all for giving me the opportunity. I'm sure there's a ton of questions about policy that's coming down the pipeline, but I'll just open it up for questions and we'll get through it. I think we've got at least half an hour. So, yeah, let's have the first question.
Well, great. Thank you, Congressman. And I'll just say for everyone, if you have questions, please in the chat, put them, or if you want to let me know and we can unmute you and have you ask your question directly. But I'm going to start, and you mentioned it a little bit, Congressman. I think one of the big challenges is the fact that this is a public health crisis that has, because of the situation and the way to impact the public health element has led to an economic crisis. So can you walk through maybe from your end how it started, when things began early on, what your mentalities were, and then how that has evolved as time has moved on?
Absolutely. So I think the first time I heard COVID-19 coronavirus was probably late December, middle to late December. People started talking about the flu deaths. Most people don't realize that between October and February of this past year, 50,000 people had died from the flu. So, the whole thinking was that COVID-19 was just a different type of flu, and it's not going to be that bad. We need to go about our lives, wash our hands. We heard it all. But then the head of the CDC came in to meet with the Republican conference, and he was very stoic, and he said that this is serious. It's going to be very bad. The number they threw out was actually 2 million. So when someone says that more people are going to die from the coronavirus than have died in all wars in the history of our country, it got everyone's attention. It was very, very serious, and we took extreme precautions. And there's going to be dozens, if not hundreds, of PhD dissertations on whether the steps we've taken thus far were too much, were too little. 2 million people, it does not seem will die from the coronavirus. Now, we have had 100,000+ deaths, but it's been a disparate impact. The urban areas have had much larger fatality rates, and South Carolina, we've been very fortunate. We have not been as affected in the death toll. So we shut down the economy. We gave the stay-at-home orders in most states, and we did not have a challenge with our economy. 2008, the banking collapse, we had an economic flaw in our economy. And so this is different. We were experiencing the greatest growth of our economy in many years. Our unemployment rate was extremely low, and we were really doing fantastic. To have the federal government and the states shut down the economy, we went from having the lowest unemployment in history to the highest unemployment in history. And so I'm really not for the federal government giving away trillions of dollars, but if the federal government is going to shut everyone's business down and end everyone's way of life on a temporary basis to save lives, the federal government needs to step in. Some people have referred to it, they've compared it to eminent domain. So, if the federal government's going to shut your business down, the federal government needs to say, well, we're going to help you get through this. We're going to help you weather the storm. So, we've done a number of things with testing. The payroll protection program has been a huge success. And then, there was substantially plussed up unemployment in most states, and a number of other variables that have allowed us to really not have as severe of an impact thus far. Now, that said, this is ongoing. Different states are reopening at different rates. It's become partisan, generally speaking. Republicans and Democrats view the role of government different. Republicans think government should be left to the core function, and Democrats generally think the government has all the answers and should kind of facilitate the greater good. The answer is probably somewhere in the middle. So we've got to find a way to thread the needle to reopen safely, but we got to get reopened. The federal government is at $30 trillion of debt. And as we talk about this next package, what to do, we still have 19+ million people unemployed. I mean, we have to do something to help them, but that doesn't mean that everyone is going to get a check. The vast majority of this country has not had income disruption. And so if you haven't had income disruption, we don't need to give you $1,200. We don't need to give you $4,000. Somebody's talking about $8,000 vacation credit. I mean, you know, we need to help the people that have been adversely affected by this. We need to maximize the number of businesses that survive this challenge. But we got to get back to work, because that's the only thing that will do it. But we got to do it safe.
Absolutely, and I think everyone would echo those comments. We have a question specifically around workforce and training. You know, obviously, you know, people have lost their jobs and may not. Some jobs have been just furloughed and are coming back, but others are gone permanently. So, what is the role of what is going on, and what is Congress's involvement in assisting local areas with federal training funds and programs that can help with those who are unemployed, because of the fact that we've had such low unemployment in the last 5 years, a lot of those programs had been reduced in their funding because there was not the need that there had been before.
Sure, that's a great question. And honestly, what we're doing two things right now. One, we're trying to figure out a way to reform law enforcement in the wake of the murder of George Floyd and the ensuing protests and in many instances riots. We're trying to find a way to help law enforcement, protect law enforcement, but also instill trust in minority communities that do not necessarily trust law enforcement to the degree that I wish that they did. But we have to change our policies to help fix this problem. So that's one thing we're working on. The other thing we're working on is the next phase of economic relief for the coronavirus pandemic. So the question is, what do we do? Before we get there, I need to paint a picture for you. Prior to COVID-19, we were going to spend $1.2 trillion more than we brought in revenue. So we had a massive budget deficit. Our debt is currently, the debt clock says 26 trillion right now, but that's not taking into account the PPP loans that are all going to be forgiven because of the new rules. It's not taking into account a number of other parts of our balance sheet. I mean, it's really $30 trillion by the end of this year, definitely next year, $30 trillion. Our federal spending for defense is about $720 billion. Our interest payment next year on our debt will exceed that. So we're going to spend $800 billion on our interest payment next year. Put that in perspective. The entire discretionary budget of the state of South Carolina is about $8 billion. So it's funny money. We have reckless policies that have gotten us here, and we have to do something. So that's the picture I want to paint for you. The next thing is this. You start looking at places that need money. State and local governments are already underwater with reckless fiscal policies all over the country. I mean, South Carolina alone has a $20 billion pension shortfall. So you go across the country, states, cities, municipalities, counties, there's a massive insolvency issue that is going to be kind of creeping up on us. On top of that, you have revenue disruption. The economy being shut down has reduced tax revenue across the board. So there's going to be a shortfall there. What are the state and local governments going to do to survive that? They employ tens of thousands of people in each state minimum. And so how are we going to address that? Can the federal government write another $1 trillion check? Is that the right thing to do? I don't think we're going to be able to make everyone whole. DOT alone, DOT is projecting a 30%, Department of Transportation in South Carolina is projecting a 30% shortfall in revenue because nobody's on the road. Nobody drove for 3 months. So, we just have all of these problems. And I mean, if you truly add it all up and you want to say, well, we're just going to make everybody whole, that's another $5-6 trillion. We can't do that. It's not within our fiscal capacity. So, you know, and then on top of that, after COVID, after the vaccine, everybody's back, life's normal. We still revert to a $1+ trillion deficit. So we're going to have to tackle this. We can't keep spending money we don't have. It's immoral. It's literally our kids and our great grandkids' money. Nobody's even going to be able to. We're not going to be able to responsibly balance the budget within 6, 8, 10 years. So we're going to inevitably have $40 trillion worth of debt. I know that we're talking about debt and deficit spending when we need to be talking about economic relief for COVID, but we're going to get extremely surgical with this next relief package. If you're unemployed because of COVID, we're going to help you. But we're also going to make sure that you get back to work as quickly as possible. We're not writing big checks. We just can't do it. That was a long answer. I'm sorry.
No, that's fine. And it led to about 3 other potential questions, certainly. But before we get off of this, I do want to ask, as it relates to, you know, you mentioned with the unemployment piece, and I think, you know, we've heard from some of the manufacturers and businesses here in our region that one of the unintended consequences of the relief package is you do have, I mean, the reality is you have some people who are making more money not working than the job that they were working before. As you're looking at your next package and moving forward, how do you address and fix that issue? Certainly you want people to make more money, but we'd like them to make more money working and not make more money staying at home collecting money from the federal government. So
the additional $600 runs out on July 24th. That will not continue. You know, the legislation, the CARES Act, was put together very quickly. Generally, I think it was a big success. There were a number of problems. That was one of the bigger ones. There were some problems with the payroll protection program. We fixed that. Anytime you spend trillions of dollars within a week of planning, you're going to get some things wrong. A number of people, including myself and a number of my colleagues in the House, and Senator Scott and Senator Graham were adamant about this. You know, you can't give people $926 a week to not work. It's just, I want to help people that need help, but I'll give you a great example. If you're 100% disabled and on Social Security, so you literally, the federal government is your entire source of income, and your life didn't change whatsoever, and we gave them a $1,200 check. Like, you know, we need to help people that lost their job, whose lives have been disrupted, who can't pay rent, who can't eat. Those are the people we need to help. You know, you don't need to give a check to somebody that didn't miss a beat. So those are the conversations we're having now. We're going to get more surgical with it. The unemployment issue will be fixed. I do think that all they had to do was say you can't make more on unemployment than you did prior, and that solves the problem. And, you know, start enforcing the fact that if your job is offered to you, you have to go back to work. And if you don't, you lose your unemployment. That was something that could have been included that wasn't. But overall, it was a good effort. I think it made a big difference. It stemmed what would have been a really horrible time in our country. I'm not convinced that we're out of the woods. And I see one question here about how to get back to work safely. And
right.
You know, that's a really great question, because if we don't continue this progress of reopening, if we reclose, God forbid we go into total lockdown again, it's going to be bad. So what do? We continue to invest in personal protective equipment. We continue to follow best practice of social distancing. I have a CrossFit gym and a yoga studio, and you know, our CrossFit gym, you can come, and our capacity used to be 50 or 60 or 70, and now it's probably 16. So we're able to still conduct business. People can come and work out in the gym. We sanitize everything between classes, and you are able to socially distance while exercising. You know, but we still have major challenges, like the yoga studio, for example. we used to put 75 people in a room, and that's how the business model works. Our capacity right now is 12. Just the way the room works, we can't fit, anywhere near as many people. So our business model's upside down. So we're having to make changes to it. We're having to find a way to make it work. Everybody's going to have to do that until we get a vaccine. There's a lot of people that don't like vaccines, and I'm in the South Carolina Air National Guard. I don't get a choice. So I hope they get the vaccine right. And I think a lot of people probably will get the vaccine, and, herd immunity, it works. So I think that'll come out December, January, February, March. And then we're going to make sure that this never happens again. We were overly reliant on foreign manufacturing for pharmaceuticals, for personal protective equipment. We did not maintain the domestic capacity to address this crisis, and we're going to change that. So I think that answered your question. But yeah, we got to be smart. We got to be safe. We got to use common sense, and we got to make sure that we have another thing's convalescent plasma. So right now, best practice for treatment of COVID is to give the patient convalescent plasma, which is blood platelet or blood from a person that has recovered. It just has the antibodies in it, and it helps your body kind of understand how to attack and overcome COVID. So the blood connection in Greenville is fresh out. So if you know somebody that has had COVID and recovered, encourage them to donate blood. If they have rare blood types, it's even more pressing. So as long as the healthcare system is not overrun, we will continue to reopen responsibly, and that's the path forward, in my opinion.
And that's a very good point. When we had an economist from Clemson on one of our calls a number of weeks ago, and he said one of the points of the shutdown was not necessarily, or was not to get rid of the virus. That wasn't going to be possible, but it was to get the healthcare system prepared so you didn't have this onslaught at one time. What we're seeing now with the reopening is some of the states, South Carolina being one, but Florida, Texas, probably getting more, notoriety for it, seeing increases in their daily number of COVID cases. I think at some point there's going to be, if we're not there already, a real challenge around this, exactly what you said. We've got to maintain the economy. We've got to get back to work. But people's fear or the fact that we're seeing so many more cases every day, how do you think we as a country and communities should be messaging kind of that balance between we've got to reopen, but we know there are more cases, just be smart, do all the things around PPE and distancing and things. How do we balance that, and what's the messaging that you think we should be sharing?
That's the most important question right now, and it's simple. We shut the economy down because we didn't understand what we were fighting. We needed more information. We had the potential of 2 million people dying, and we needed to develop the personal protective equipment. We needed to develop an understanding of COVID, and we needed to get a plan in place that would allow the healthcare system to not be overwhelmed. In Italy, when we were shutting down, they were literally they said, if you're over 60, you don't even come to the hospital because we don't have the capacity, and we're going to give our resources to people that are younger. Sorry. So we wanted to avoid that here, and that was the right thing to do. So now that we have more information about COVID, now that we understand the challenge it faces, the only reason that we will shut down again has nothing to do with testing numbers. The only thing is hospital capacity. The only thing is the small percentage of people that need a ventilator, that need oxygen, that need convalescent plasma, that go to the hospital that are near death. Those are the people that number is the one that matters. Testing is readily available all over the country. We will see the numbers go up. We just will. If you get sick, you need to stay home. You should never take a risk of, I might just be tired. oh, I had a couple cocktails last night, I might just be a little bit hungover. You need to say, okay, what have I been doing? Have I been social distancing sufficiently? Is there a chance I have COVID? If I do, stay home. Like you just have to be hypersensitive to it. Another thing is it's all about risk. I can get COVID and I statistically am pretty much guaranteed to survive. My parents, less likely. If you're 0 to 18, the fatality rate, it's not even a top 50 killer. So, this whole thing with schools, I mean, we have teachers' concerns because teachers are generally, not going to be as young, but we have to take steps to protect the vulnerable people. If you're over 60, if you have an underlying healthcare condition, we need to make sure that we are protecting you, and you need to take steps personally to protect yourself. So, I do think that there will be a portion of the next phase that will address exactly that, because everybody else needs to get back to work, do it safely. But if you are vulnerable, stay home longer. And if you're in an area that has a spike, you need to even take more precautions. So, we got to be careful. We got to be intentional. We got to be methodical, but we cannot continue to impede our economy. One of the best statistics, I think, is this was a few weeks ago. South Carolina, we put 400,000 people out of work, and we had less than 400 deaths at the time. So the poverty, the social challenges that are created by putting 400,000 people out of work, that equation is just not. It's not a winning calculation. So we have to get back to work. If you are more vulnerable, take precautions. If you are going back to work, you need to also take precautions. And I think that's the path forward.
And I'll get you out on this one, Congressman, as it relates to that kind of the compliance with safety rules and local rules. What do we do to make sure that people are following the rules that are in place in the communities they live?
So, Greenville City just did a mask ordinance for pharmacies and for grocery stores. And if you think about it, if you're over 60, those are the only two places you have to go. So, that's a great example of kind of threading the needle. To Austin, Texas, their mayor requires you to wear a mask at the gym. So you got a business that just reopened and they're struggling. They're barely gonna survive. And then you say, all right, people are coming to your business to exercise and they have to wear a mask when they exercise. I ain't going to the gym and wearing a mask. I just won't go, or I'll work out in my garage. So we have to be careful to say, take precautions necessary to protect as many lives as possible. If a business wants to require masks to enter, I'm all for that. That's their decision. That's how the world works. I walked into Starbucks yesterday and they required me to wear a mask. And so I wore a mask when I went to Starbucks. Now, if you come to my gym, we're going to make sure that you're using the hand sanitizer. We're going to make sure that you're wiping everything down, and we're going to tell members that are over 60 or have a healthcare condition that they probably shouldn't come to the gym. But everybody else, we're taking the precautions we can, and we're doing everything we can to keep them safe while also getting back to work. And I guess I saw one question here about manufacturing jobs. There are positions that are asked to go back to work that social distancing is harder than others. So we just have to do our best. And, like I said, if you're over 60 or if you have a healthcare issue, there's still a federal law in place that you do not have to go back to work, and that it was phase 2 legislation. I mean, it's been overlooked substantially, but you do not have to go to work if you are over 60 or if you have an underlying healthcare condition. So, I mean, if your boss is giving you grief, we passed a law saying that they had to give you, time to protect yourself. So that said, it is a balance, and we need to make sure that we're protecting as many lives as possible while also getting the economy back going, because I said earlier, the number of dissertations written about this is going to be incredible. We don't understand what happens to long-term fatalities as it relates to 350 million Americans not going to the hospital for 4 months. How many people would have had something caught before? What does that look like? How many people were unable to get medical treatment because all the hospitals were closed for non-emergency procedures that would have been caught? How many people have food insecurity that, their situation was further exacerbated? How many families had domestic violence? I could just keep going. You get it. I mean, the problems associated with unemployment, the problems associated with shutting down the economy, you can't really put a metric on it. And so we have to get reopened, but we need to be careful about it. And I think that South Carolina is doing a great job. And as long as we maintain our healthcare capacity and we do not allow it to be overwhelmed, we're going to be fine. Like I said, the vaccine's coming. I'm hopeful for sooner than later, but it won't be past March. So, I'm telling all my small business owner friends that they just got to maintain as much capital, as much cash on hand, keep their liquidity. If you got to get a loan to survive a little bit, be careful, manage your payroll and maximize revenue, do whatever you can to get to the end of the light at the end of the tunnel. It is there. This is temporary. We have the best economy we've ever seen before. We just got to get back to it.
Well, great. Well, Congressman, I'm not going to make you answer this question because we're up against your time and we appreciate it. But I know, Lori Rovin here in Greenville, and she asks in general, and I think you've said it multiple times, how do we depoliticize this issue, especially around the health elements? And I know you are certainly someone who is working towards doing that. So we commend you for your efforts, and I think that will be a key element of it as we move forward.
I'll jump in on that because that's the biggest problem. This is not a Republican problem. It's not a Democrat problem. It's an American problem, and we need an American solution. I'm frustrated that the importance of the November election cannot be overstated. And the problem is that we've got 5 months until then, and every single thing we do has a political lens to it. So we have two competing bills. Senator Scott has the Justice Act. The House Democrats have a proposal that most argue overreaches. This is not hard. We should work together to craft policy that fixes the problem. The coronavirus legislation was there were a lot of politics there, and the response has been politicized by both sides. So we got to work together. The American people deserve cooperation. They deserve cool heads coming to the table to fix the problems that we face. After we get through this, we are going to have some of the biggest challenges we've ever faced. Our debt and our deficit are going to end our way of life in a way that we can't fathom. So if we don't get a hold on our financial solvency here in the next few years, we're not going to be able to, and we're not going to have a country. So we've got to be responsible. We've got to be good stewards, and we've got to find a path forward that we can all live with. It's not going to be a Republican or a Democrat solution. It's not possible. We have to work together. It's challenging, but that's where we are. And I just want to say, Laurie, great to hear from you. It's been too long. I hope you're doing well. And again, thank you all for having me on. And I'm available. My team's available if we can do anything to help. My website is timmons.house.gov, and my cell phone number, for those of you who don't have it, I'll just type it right here. How about that? So you all have it. My cell phone number is in the chat box if you need anything.
Well, Congressman, thank you so much. Again, we appreciate it. We appreciate your service and all you do for us here in the Upstate. And hopefully next time we see you, it will be here and we'll all be able to be gathering in person. So thanks again for your time.
Hey, thank y'all. Y'all be safe. Take care.
All right. Mayor Roberts had to scoot out. They have some other meetings there in Anderson and ANMED. So I am going to walk us through the remainder of the program. We're going to switch things up a little bit. I did want to let you know that our next two TATT Chats, the ones for the month of July, will be held July 16th and July 30th. Right now, we have the Greenville Drive scheduled to be on with us July 16th. We're anticipating by then they'll have some clarity about the schedule for the season or whether there will be a season this summer. So be sure and mark those dates on your calendar. At this time, I'm going to turn it over to Sharon and let you do the county updates, and then Aaron will wrap you in at the end after these are done. But I know we want to get through the 5 county updates we have for today. So Sharon, I'm going to turn it over to you and let you introduce that section.
Sorry about that. We have first up Roy Costner from Pickens County. He is the county council chair, and he's going to give us a quick update, and then I think he's going to scoot off of here after that. So just give us a quick update, Roy.
Thank you, and thanks for the opportunity to speak with everybody. Just real quick, in Pickens County, we were at 267 cases, I guess, last Saturday that were active, and as of today, it's 349. A lot of testing going on. Great work that's happening with DHEC, and I mean, it's one of those things where I'm excited to see that work. One of the questions that we're getting a lot now is about the face masks, and of course Clemson passed their ordinance, and I've had a couple of calls from the other municipalities. I've had folks calling me. Interesting, when Congressman Timmons was talking about the concerns about schools, I actually had a couple of teachers calling concerned that we're going to pass this and keep schools from opening up, because their concern is that these kids aren't going to learn as well virtually as they do in the classroom, and they really want to, or their hopes are that we can get them back to going to school as opposed to staying on these great and wonderful Zoom calls. The only other couple of things to mention, we are, as a council, working on a couple of local ordinances. We're not as blessed to have the incredible funding that Greenville County gets, so we're working on some of our own stuff for local ordinances for small businesses and to try to help some of those folks out. We're at 2 readings in. Hopefully by this next July meeting, we'll have something available for them. And I guess 2 more things that are going on in the county. One is we're working towards a task force on broadband and how we're going to approach that, in hopes that we can get some federal funding to service some of those areas for when we do have to have these types of meetings where these kids can get on and get access. And the other is something I've been working on just this week. I did an interview with Channel 7 today about a situation with one of the subdivisions called Quail Haven in Pickens County that has this horrendous problem with flooding. We see a solution with SCDOT, and we can't get them to talk to us, so we actually had to pass a resolution, send a letter to the governor, and we're beginning those communications. So if you see something, that's what that is about, is solving a problem where water was diverted and it's going right into a subdivision and flooding out these homes. So that's my update from Pickens County.
Okay, thanks, Roy. Next up, we have Carol Burdette, who is the president of the Anderson County United Way. Carol, I think you're on.
Thank you, Sharon. I really appreciate the opportunity. Just to give you all a few updates, one of the things related to COVID and the testing, we've had 3 sites open. Today was the 3rd one at Holman Park Elementary, and last week at the Civic Center, I believe they tested over 800 people. And as Roy said, obviously the cases are rising. As of the report I received last night, we had 505 cases, and to date 10 deaths. And so we continue to look at those numbers every night, and it is an upward trend. And the biggest question, I think, on everybody's mind, even those of us that do not have children, will school start back in the fall? And I was in a meeting last week with all 5 of our superintendents, either them or one of their representatives, and it sounded like they were gung-ho to go, no hybrid, they were ready. But I think that is a question that is back and forth almost every day. And I don't know that we will know the answer until we get much closer into August about whether students will go back at a full schedule or what that will look like. But as a United Way, we continue to work on various very important pieces related to some of the things that Congressman Timmons was talking about that has to do with people that are affected by COVID. And one of the things that we've recently done is we've created a collaborative among SHARE, AIM, and Clemson Community Care that serves Pendleton in our county. And that is to try to help ensure that every family that needs help, every individual that needs rent, mortgage assistance, or assistance with their water or power, that we can keep them in their homes. And so I've seen more collaboration during this time than ever. We've been working with the free clinic to help people have medication that they need. And lastly, we're working with county economic development and some manufacturers talking about how can we increase the child care opportunities, because we've seen obviously child care centers that are not open, they're not at full capacity. So we are working on that issue right now, and I think that will be consuming us for the next few weeks on how we can make child care more available to those people that are working in particular in the manufacturing sector. So that's what's going on in Anderson County. Thank you.
Thank you, Carol. Next up from Greenville County, we have Jokeitha Seabrook, also from the United Way there.
Hi, everybody. Thank you so much, Dean and Sharon, for inviting me to be here today. Just wanted to give you a couple updates that's happening here in Greenville. You know, of course, with everything going on with COVID and Greenville being a hot spot, a lot of our organizations are still at home. We at the United Way were able to go into the office 1 week and then turned around and went back home to work remotely because of the numbers, and we want to make sure everyone stays safe. Just as Carol has said, we're not a lot that is unique with what is going on here in Greenville. As far as the schools are concerned, there is a decision that will be coming down soon. I think that Greenville County is probably looking at some sort of a hybrid, and we're waiting to get some confirmation on that, so that way we know how to help those folks that may be working, that may be being in school remotely or going back into school. But just as Carol said, we really just don't know. Like to add that we have raised, United Way has raised the COVID response money in the total of $1.2 million, and we have given out $540,000 of that in mini grants. Anything from food. We felt like food was the first thing that folks needed. Housing and utilities was second. And then we are now moving into healthcare now that this is going on as long as it is, as well as education and just learning for folks, so that we can kind of help make sure, you know, is everybody staying safe? Do you know that you need to wear a mask? And in that, what we've learned is that our Hispanic population are right now feeling the effects of this in a hard place, along with other minorities. But because a lot of the information is being shared, whether it is on television or even on billboards that you all see that says wear a mask when you go places, they're not in Spanish. And so we've pulled together a coalition of different Hispanic leaders here in Greenville to find out what are the barriers, how is it that we can help. Part of the United Way funding that we pulled together out of that $1.2 million has been to go to some specific places that serve the Hispanic community that we have here in Greenville, because a lot of the federal dollars that are coming down are not you know, if you're undocumented, you can't get access to those funds. And so United Way wanted to make sure that we fill that gap. You know, we have localized our 211. There is a 211 line that is a South Carolina 211, and United Way has started a resource line that where you could call 211, but then hit resource line for Greenville and get Greenville specific information, where we have our AmeriCorps members that are helping us run that line, so we keep the information as updated as possible for our Greenville folks. As a part of a coalition that we also started, we have some local nonprofits that are doing housing, so United Housing Connections and Share and Community Works and so forth and so on. We've given many grants to them so that way they can do some target work to help folks with rent. We noticed that there are a lot of shelters that closed down at the very beginning, and they're not opening to new folks. And so hotels have been a place where some folks have been having to find refuge. And so we are using those funds to help with that, but not just that, because we also want to make sure that there's a sustainable way to move forward. So one of the things that we are taking into consideration is there a way for us to do rental insurance or master leasing going forward? Because really we've moved from a COVID response that we thought was going to be a couple months really into a recovery mode, because we see that this is lasting a lot longer and that it could ramp back up. And so those are some of the things that we have going on right now. I will mention that we are in the midst of a RFP right now. And so we are looking into redoing our funding, and our grants were due on June the 11th. And so we're getting ready to change out on that. But we also are concerned about our local nonprofits because a lot of them had to close or didn't have the opportunity to work from remote. And so we're trying to help with capacity building and getting with the Nonprofit Alliance to see how else we can serve those organizations. Sometimes it always can't be funding because sometimes the funding just is not there. So with that, I'll turn it back over.
All right, thank you, Jokitha. John Kamey, are you on the line today? Okay, John does not seem to be. Amanda, do you have a quick something that you can share for us from Lawrence? Is Amanda still there?
Hey, I am still here. I can't, my screen is messed up. I was listening in the background, so I apologize. Can you hear me?
Uh-huh.
Okay. Hold on just a moment.
Yeah, sorry to put you on the spot.
No worries. I was just trying to figure out how to get where everybody can see me, so I apologize. All right.
That's okay.
Now, can you see me now?
No.
Okay. Well, regardless. Okay, so I apologize.
That's okay.
Yeah, on the spot. Sorry. Yeah, everything's good. Our numbers are on a very, very quick rise. I know that they are going up by the minute, it seems, but there is also a lot of additional testing. So I know that there is a lot of leadership in the community that has that is monitoring that, and I know that the schools are meeting. I'm serving on the L55 task force, and there's the L56 that's districts. And they are trying to figure out, what they're going to do with the start of school this year. So everybody is still just moving along, just trying to adjust daily to figure out what the best way is to move forward, I guess, and just keep our head above water as far as the small businesses and the healthcare system with the numbers on a rise.
Okay.
Sharon, if I can interject in there.
Yep.
Amanda and Jonathan Elwick did a wonderful job today during our entrepreneur ecosystem call, talking about what they're doing around digital media in Lawrence County. And Aaron is going to talk about that in a minute as well. But Amanda, I think you guys have really trumpeted up the role of trying to promote your businesses in town, in the county, especially through your Shop Lawrence program and Think Local program.
Thank you. And that reminds me, I can't believe I didn't say this, and I imagine John would have said if he were able. I'm sure he just got pulled away. Like I said, I know that things are crazy in Lawrence County right now, as for many. But County Council did approve funding for to be administered through the chamber on Tuesday night at council for us to be able to do some micro grants for our businesses. So we are very excited, and we're in the process right now of putting together the application and the allocations committee that will review all those applications. So that's fantastic news for our small businesses here.
Mm-hmm. And speaking of the, so Lawrence, speaking of Jonathan with the Main Street Lawrence, he sort of spearheaded an article that we did with some of the Main Street groups, and I'll put a link in here shortly. Next, we have Annie Caggiano who's with Economic Development in Oconee County.
Hey, good afternoon, everybody. So in Oconee, we've obviously got a few different things going on. Tornado recovery and relief is still a focus of ours right now. We still have yard debris that'll take probably another couple months to get out of everyone's streets and yards, but working on that with DOT and county pretty diligently. The United Way still has some funding left in their tornado relief, so still working with families to make sure that they are bridging that gap between insurance coverage or no insurance to make sure people can really get back into their houses. But most everyone has housing right now, so it's just that getting through insurance and making sure we rebuild that area. So the flip side of that, Corona, we're still dealing with that like everybody else. We have largely avoided positive tests for some time being in a rural area, but we have just now started to see the spike that others had seen. So for a small county, we've seen numbers in the 20s between, I think today was 13. So I think we're seeing a lot more people wearing masks, but no talk of ordinances or anything like that. The county right now is focused on the budget. Tonight will be our third reading and a special called meeting to pass that tonight, because obviously between the tornado and COVID, we've had an unusual situation to plan for the future, but we feel like we have a solid budget to go forward tonight. From an economic development perspective, we are busy, which is great. I think it's a great sign for the economy. A lot of the things that we work always look 12 to 18 months out, so people feel confident right now. Companies feel confident. Like the Congressman mentioned earlier, we are talking to a lot of international companies or national companies that are going to reshore some of their process to the United States to deal with the ongoing tariff issue, but also disruptions in the supply chain that they've seen during the COVID shutdown. So that's a big thing for us right now. We're busy with that. And then we're also still focusing on our existing industry. I know there's questions about working safely in manufacturing facilities. Those are our largest employers here. So the state, working with FEMA, has distributed the no contact thermometers to all the economic development offices in the state. We received just under 100. So we're working with both our manufacturers, large employers, but also our tourism destinations and our farms to make sure that they have access to those thermometers and can make sure that they're testing their employees before they come in every morning. That's all we got going on.
Great, thank you, Annie.
Mm-hmm.
I'm going to turn it back over to Dean now. I think, right, Dean?
Great, thank you to Sharon, and thank you to all of you for providing the updates. I think those are so important to kind of get a picture of where we are across the upstate, and Sharon will include those along with some tidbits from the other counties that we had done the last time with the in-person updates in the review from this session. I'm going to turn it over real quick to Aaron Oots with our entrepreneurial ecosystem group. They had a great meeting today, as I mentioned earlier, with Jonathan and Amanda. And Aaron, can you just share a little bit about that and what you have moving forward?
All right. Excuse me. Yes, Dean, thank you very much. And it's nice to see you again, Amanda. We usually meet quarterly, and this is the Upstate Entrepreneur Ecosystem, and that consists of pretty much anyone who helps a business owner or helps an entrepreneur start a business, or a business owner maintain or grow a business. So that's pretty much all of you as well. So feel free to join our meetings at any time. But we have been looking at what are the causes of companies either succeeding or not succeeding during this pandemic. And they've kind of boiled down to three, one of which is ability to pivot or be resilient and change. The second is ability to communicate. And that not only includes getting information from the internet or digitally, but also being able to get the information out. And then third is making sure that their financial statements and they understand the kind of underpinnings of the financial underpinnings of the business. So we started today with Amanda and Jonathan talking about how they are working with their businesses in Lawrence City and Lawrence to do digital audits to help the businesses understand where they are in terms of their ability to use social media, websites, Facebook to get their messages out and then provide training for them afterwards. And then on July 22nd, we will have Earl Grigorich speak, and he is the area director for the Small Business Development Center. He will talk to us about financial statements and how to work with our business owners to make sure that they regularly prepare the financial statements and that they are usable documents that will make them even more prepared when they need to get funding or either understand where they can cut costs or increase revenue very quickly. So that will be July 22nd. So watch for emails from Justine on that.
Great. Well, thank you, Erin. We appreciate it. And before I go, I do want to thank, we had up on the screen our leadership level funding partners, and we want to thank all of them for their ongoing support, as well as our funding partners at the other levels. Without you guys, we would not be able to be here and continue to do the things that we've done to support the community here over the last number of months. So we again want to thank all of you for your support. As I mentioned, we will not have a call until July 16th. We hope everyone remains safe and enjoys the 4th of July holiday and our weather with the afternoon storms and the pretty weather we have had. But again, thank you all for being part of today's call. Thank you for all you do here in the Upstate and for your support of TATT at the Top as well, and the idea of collaboration and working across the region. So with that, I will close this for today. And again, thank you. And if there's anything we can do to support you, please let us know. But have a great rest of the day and rest of the week.
Thank you, Dean.
Thanks, everybody.